Hi, I'm about to suction my patient's trach. I have already washed my hands, did hand hygiene, put gloves on, and checked my patient's ID and birthday. So now I'm going to get this set up. I have my towel, my suction catheter kit, and saline, and I have my ambu bag. I'm going to place this towel across his chest just in case during the suctioning process that there isn't any secretions that go on his gown, just so I don't have to change his gown later. Now I'm going to set up my suction. I'm going to turn this on. And now it's in the low section, but once you put your finger on it, it goes up. So you want it to be 80, in between 80 and 120 when your finger's on this. You can adjust it by turning this dial if you need to, but it is already set to what it needs to be right now. So that is ready. Next, I will set up my ambu bag. I will need to turn this dial and turn this up to 100 or 15 liters. I know this is ready because this is full of oxygen. I next will put the head of bed down to prepare him for suctioning. It's easier to access his trach this way. And remove the pillow from underneath his head so I don't hit his chin while going through. I've got to be careful so this oxygen device does not fall off of his trach. Now I'm going to open my suction catheter kit so I can take off these gloves. And the reason we are suctioning is because he either has a lot of secretions or his pulse ox is low. There are other reasons too, but for this case, this is what it is. So I'm going to create a sterile field with the suction catheter kit. I'm going to carefully open this and slide it out. I could touch the 1-inch border while opening it. I'm opening it away from me first. I don't want it to shut on me. Otherwise it will not be sterile and we'll have to get a whole other kit. Okay, that's folding in, so let's come on, bend down. Okay, I'm going to take this box out that's in this flap. To open it, you just push these two sides. The inside is going to remain sterile, the outside will not. I want to make sure that it shuts as a box. There's plastic inside the box, and that's where the saline will go. So my hand goes on here on the label. I will flip this in the garbage can without turning my back to my sterile field. Put just a little bit in. Open. Oop. Open. That should not have shut on me, so I would have got a new kit. Open this. Now that this is open, I'm going to apply my sterile gloves, starting with my right hand. I have my sterile gloves on, and you notice they are bigger than the other sterile gloves that we have, so it is kind of tricky during this process, but you'll see I have really very tiny hands. I'm going to take this catheter out while being very careful that it doesn't flail around. Now I'm going to wrap it in my dominant hand, which is going to remain my sterile hand. And hold on to it there. So now this is all sterile, and I'm going to designate my non-dominant hand, my left hand, as my non-sterile hand. I'm going to grab my suction that I have already set up and attach this by pushing it in. Now I can touch this with my non-sterile hand to test it in this saline. It is working, it's suctioning the saline, so now I know that is ready to suction the trach. Before I suction the trach, I have to give 2 pumps of the ambu bag to the trach because he will not have oxygen while I'm doing this procedure. So as soon as I take this off, I need to give 2 pumps. 1, 2, and now I'm ready to suction. Do not suction on your way in, only on the way out. So I'm going to go in about 4 to 6 inches or until you feel resistance. Now suction on the way out. Be very careful that this does not flail around or touch the chin. As soon as I'm done with 1 pass, I have to immediately put oxygen back on his trach because he does not have any oxygen supply while it's in there. This is not staying on. Okay. Now I'm going to reassess my patient and see if I need to go for a second pass. His pulse ox is back up and there's no more secretions in his trach, so I know that I would not need to go for a second pass. Now I can rinse this in the saline. If I were to need to go to second pass in the trach, I would have to wait 1 full minute, but now that I'm going into the mouth, I don't have to wait for a minute. I'm going to go in the mouth and in the nose. Now I'm completed with the procedure and I'm going to detach. Keep the catheter wrapped in your hand. Take the glove off with it already in there. Hold it in this hand. Take it off so they're inside each other and put that in a biohazard bag. And now I'm going to clean up my procedure, clean up my area, turn off all of this equipment, and I'm done suctioning his trach.